You're listening to Morning Edition on this Tuesday here on WCBU. I'm Rich Drager. A recent study from a consumer advocate found Hopedale Medical Center in Tazewell County had the shortest ER wait times across the state of Illinois. One Hopedale medical official likes to believe shorter waits are possible at larger facilities. WCBU correspondent Tim Rosenberger reports.
The study reviews the 2024 performance of more than 2,000 hospitals across the country. This includes about 150 Illinois hospitals. One data point is ER wait times. The national average was almost 3 hours. The longest in Illinois was over 5 hours. Peoria Proctor, Carl Broman Medical Center are normal, and Bloomington's OSF St. Joseph Medical Center were all 3 or more hours. Hopedale Medical's was only 50 minutes. Emily Whitson is Hopedale Medical's Chief Operating Officer. She says the study affirms what they already know.
I think our patients, especially our in-house patients, know that if they come to our ER, they're going to get in fairly quick.
Dr. James Brown is a co-founder of Emergency Physician Staffing Solutions. Brown and his team help staff doctors for Hopedale and 7 other central Illinois hospitals. Brown stresses that 50 minutes is an average. He and Whitson usually observe wait times of around 10 to 15 minutes. Brown was excited, but not surprised that Hopedale had the shortest wait times.
I've worked in a lot of different hospitals, and honestly, it's that culture of patient service that sets Hopedale aside because they really, really care about their patients. And consequently, that's why their patients care about their facility, too.
The study lists Hopedale Medical's overall patient rating as poor. It lists complaints as poor staff response time to patient aid, nurses and doctors failing to communicate, patients often not getting requested help, and occasionally dirty facilities. The study states these ratings aren't necessarily indicative of a hospital's quality. Hopedale Medical didn't respond to a request for comment on the complaints. The hospital's Google reviews fare much better with 96 ratings averaging at 4.5 stars out of 5. Hopedale has just 5 treatment beds. Bigger hospitals in Pekin and Peoria house 20 to around 55. The lower traffic volume doesn't guarantee short wait times since the doctor-to-patient ratio is equal to higher capacity hospitals. Hopedale patients come from a 20 to 30 mile radius. Brown says there's an amazing need for critical access hospitals in rural communities. Recruiting physicians for smaller population ER hospitals has been a challenge in recent years. Medical education costs are rising, and students can't defer loans like they used to. Brown says primary care and family doctors also aren't necessarily getting ER training.
So now what we're faced with is a shrinking population of emergency physicians, and so increasing demand, and unfortunately a lot of them tend to want to practice in places where they have a higher level of acuity, higher populations, consequently higher pay, so that makes it difficult to recruit these providers to smaller communities.
Many rural communities have programs that help doctors with their tuition and other fees if they sign on to the rural area.
Those are big programs, but you have to have a very organized and progressive rural community to think that far ahead to be able to provide those type of services 10 years down the road. I mean, it's a difficult process.
Despite hurdles, Hopedale and its staffing contractors successfully recruit qualified physicians and nurses. Hopedale's efficiency allows physicians to spend more time with patients. The doctors then know the patients better. They can address their needs quicker and more accurately than if they were rapidly cycling people through the door.
As they line up, I can pull up a chair and sit down and talk to the people a little bit more, and I feel like I have a much better connection with them, and hopefully that translates into a better understanding of what's going on with them from a healthcare standpoint.
Brown likes to believe Hopedale's wait times are achievable elsewhere. He is growing less optimistic, though, that problems associated with long wait times will be solved at larger facilities. But he and his team continue to work on it. If Brown could airlift anything into his other sites, it would be Hopedale's knowledge and understanding of its patients.
When I take care of a patient at Hopedale and I contact their physician knows them, and the process, particularly of admitting a patient or getting follow-up care for that patient, it's clearly a model to strive for in other communities.
2 other area hospitals also had shorter ER wait times than most. Carl Health Pekin Hospital and Carl Eureka Hospital both clocked in at just under 2 hours. I'm Tim Rosenberger.
And I'm Rich Drager. You're listening to Morning Edition on WCBU.